Welcome everybody to chapter 5. So now that we have covered the first 3 months of infancy, we kind of looked at those newborn months. We're diving into the rest of infancy now, and actually going into toddlerhood as well. So what this chapter is getting into is infancy and toddlerhood up until about 2 years of age. And today we're looking at physical development. That's the first half of this chapter. And next time we'll finish up the chapter with cognitive development. But today we're talking all about how babies are growing physically. And our first stop is physical growth itself. So how are they growing physically in terms of size and shape and the musculoskeletal system? So for size and shape, in the first year, most babies are tripling in weight and growing about 10 inches total in length. So that's pretty remarkable rates of growth in just 1 year. In the second year, they're also growing rapidly, continuing to grow rapidly, but not quite at this pace in the first year. It's not as rapid as the first year. Also, most have all their baby teeth by 2 years. Just a little fun fact in terms of physical growth. In terms of body proportions, if we look at this image here, it kind of paints a picture about body proportions of infants versus children and adults. So newborn infants, their head is about 25% of their total length. And by 1 year, their head is about 20% of their total length. And kind of see it here, they're all head, right? Infants are very large heads, and that's part of the reason they're so cute. So they have big heads in infancy, and to paint a perspective for you, this adult here at the end, us adults, our heads are about 12% of our total length. So in infancy, actually when they're newborns, their head's already about 70% of their adult size, despite them being very small infants. So yes, they are pretty much all head at this point. They also lose their little pot bellies as they stretch out over this 2-year period. They begin to look more like children and babies toward the end of toddlerhood. They still look baby-like for a while longer, but they're definitely stretching out and not looking as chubby and baby-like. In terms of tracking growth rates, this is important because it can have some implications. For example, if they are growing slower than the norm, there could be potential growth restriction or stunting occurring. And this is associated with possible developmental delay, possible infection, or poor nutrition. These are just some possible implications here. On the other end, if they are growing faster than the norms, this could be associated with risk of obesity. So it's important to look at these things just to as another way to gauge the infant's overall health and see if there's any underlying concerns. However, I will say that these standard growth norms are usually derived from samples of children in Western technologically advanced countries. So I want to use these findings with caution, as always, right? It may not necessarily be a concern if a child does not align with these highly westernized growth norms because, they could reflect the growth in their own culture, which could be different. There could be different growth rates, right? So we always want to keep that into consideration. So that's size and shape. What about the other half of this picture, the musculoskeletal system? So the bones and muscles are growing to support the baby's increasing bulk and mobility. So in terms of the skeletal part of this system, newborn bones are soft and they begin to harden or ossify over time. The hand and the wrist bones are among the first to harden. It's about 1 year. And this aids in grasping and picking things up, which we see a lot of in later months of infancy and early toddlerhood. In terms of the muscle part of this equation, muscles are also increasing in length and thickness. They're growing too. And this is, as you might have guessed, associated with the ability to crawl and stand and walk and things like that. So anything related to mobility, muscle growth is definitely linked here. What about sex differences? So boys are generally larger than girls. This is a trend that we see in terms of just overall shape and size. But girls tend to mature faster. At birth, the female skeleton is about 4 to 6 weeks more mature than the males. And we see this trend reflected in later years too, especially during puberty. At puberty, in adolescence, the female skeleton is about 2 years more mature than the males. So it's kind of one of those trends that we see. And all these physical changes are more than just physical changes, right? They open new ways of learning and exploring the environment, especially in terms of mobility. So it actually plays into other areas of development too, like social, emotional, and cognitive development, which we'll talk about as we go on. But brain development definitely plays a role too, and that's actually our next stop. So we'll talk about the physical growth of the brain in infancy and toddlerhood next. So that's where we're headed, and I will see you there.